This course is called Anatomy and Physiology, and those are two different disciplines, all right? Anatomy is the study of the pieces that make up a structure, what they look like, where they are, okay, relative to each other, all right, and what they're made of. Physiology is going to be what the thing does, what is its function, okay? So this is kind of like if you were an auto mechanic, okay? If you were an auto mechanic and you knew the anatomy of the automobile, such as where the windshield is, where the engine block was, where the spark plugs are located, where the carburetor is, and so on, that's great, right? But if you're going to work on a car, it's pretty important for you to know what those things do, or else you're not going to be a very good mechanic, okay? So one of the things you're going to discover with anatomy and physiology is that there are no features in anatomy that are decorative. They all have a purpose. An example would be a tool like a screwdriver, right? A screwdriver has a handle and a shaft and a head. Why? Well, the handle is to grip the tool. The shaft is to transfer the force from the handle to the head, and the head is designed to engage the screw so that you can screw it into wood or drywall, all right? So all the parts have a purpose, okay? And the same is true in the human body. There are no features of a tissue, a cell, or an organ that are there for no reason, all right? There's always a purpose to their design, okay? The way that we go about understanding the world around us, if we're a scientist, is that we use something called the scientific method. Scientific method is something you probably do more often than not when you perform stuff in your everyday life. You just don't think about it. And all a scientific method is that you're considering a situation or a phenomenon. You make observations about it, right? You collect information about it. And then if you want to know more about it, you form something called a hypothesis. That is an if-then statement. If this is the way things work, and I do this, then this will happen, right? So you set up experiments designed to determine whether or not your hypothesis, your guess, was true. You perform those experiments and you collect that information. If that information supports your hypothesis, then you can do further testing and provide further support for your hypothesis, and then you can communicate what you know to everybody around you, right? Because you've done those experiments, you've gathered that information, and that's probably the way things work, okay? If the hypothesis is not supported, then you throw it away like a piece of garbage, all right? So we can do this as an example. We could take like a flashlight that doesn't work, right? You pick up a flashlight, you flick the switch, and it doesn't turn on. Okay, you now have some information, right? Flashlight, when you flick the switch, it doesn't turn on. What do you know about flashlights? Well, in order for them to work, they need a good set of batteries, they need a good bulb, they need good contacts, right? So you note all of that. So now you make your hypothesis, right? Your hypothesis is the batteries are dead, okay? And so the way you would state that is, if the batteries are dead in this flashlight and I replace them, then the flashlight will turn on when I flick the switch. So you take out the batteries, you put in fresh ones, and you flick the switch and you see if the flashlight turns on. If it turns on, that supports your hypothesis, and if it doesn't, that doesn't support your hypothesis. And so you would throw that explanation away and you would check other things like whether the bulb is good or whether the contacts have rusted, okay? And so you do this all the time, and the scientific method may not be fast, but it will ultimately get you to the answer about how something works, okay? And as you learn new information, you modify hypotheses, right? And then you continue to test and test and test until something about your guess is not supported, right? And then you have to throw that hypothesis away, okay? Microscopic anatomy is just a area of anatomy that deals with things that you can't see with the naked eye. We're going to learn this week that before the invention of the microscope, there was a lot we didn't understand about the human body. We even didn't understand why people got sick. We didn't understand where life came from. We didn't understand what living things were made out of, okay? And so we had a lot of wild guesses, right? But we weren't able to support any of those with hypotheses and experiments, right? But it was the invention of the microscope by Leeuwenhoek that allowed us for the first time to see an entire world that wasn't visible with the naked eye. And we discovered all kinds of interesting things that we were unaware of before because we'd never seen them, okay? So structures that can't be observed with the unaided eye, you can see with a microscope. Divisions of microscopic anatomy include cytology, which is a division of anatomy that deals with the structure of cells, which are the smallest units of living matter, and histology, which is the study of tissues, which are collections of cells with similar characteristics that work together to do something a single cell can't do on its own, okay? Gross anatomy is the kind that you can do with the naked eye, and examples include systemic, regional, surface, comparative anatomy, and embryology, okay? And so you can see here the explanations for what each one of those deals with, all right? Things that you can physically see and touch and manipulate, all right? Pathologic anatomy is the changes that take place during disease states, and that can either be a microscopic or a macroscopic pursuit, or sometimes both, right? And then radiographic anatomy is the ability to visualize structures inside the human body using scanning procedures such as X-ray or CT or MRI, and that permits us to determine the extent of damage and the location of damage without having to do something called exploratory surgery. And that's one of the things that makes it easier for us to get you into the hospital, work on you, get you sewn up, and get you out and functioning in much, much quicker time with a better outcome, okay? Physiology subdisciplines include cardiovascular, neuro, respiratory, reproductive, and pathophysiology. Cardiovascular physiology, the heart, the blood vessels, and the blood, how they do what they do, right? Respiratory physiology, the functions that go with gas exchange and the regulation of pH in the body, right? And pathophysiology, the functional changes that take place in different organ systems when there's a disease, okay? Patho means of or pertaining to disease, right? Anatomy and physiology are interrelated, and integrating these disciplines is an easy way to learn about both of them. Both disciplines use information from each other, and we've already talked about the fact that form follows function, right? There is no feature that you're going to see in the anatomy of something, whether it be cellular anatomy or the anatomy of a body region, that's there for no reason, okay? There's nothing decorative going on. Without a knowledge of structures, the physiologist can't understand the structure's function, and vice versa. That's why the two go together, okay? All right, now we get into studying, right? One of the things you're going to learn about this course is that it's content dense, meaning there is a lot of stuff in this course, okay? And if you've never had chemistry and you've never had biology, it's challenging, which means you have to develop a study strategy in order to navigate this course and be successful in it. What are some of my recommendations? Well, I like the answer to the old question, how do you eat an elephant, right? And does anybody know the answer? It's an easy one. One bite at a time, right? That's another way of saying if you have a large task, the way to accomplish it is in bite-sized chunks, manageable chunks, all right? Which means, number one, you have to dedicate some time every day to get into the material and to study it, all right? It has to be a regular thing. Number two, you have to involve as much of your brain in this activity as you possibly can, all right? So what do you have to do in this course to be successful? You must read the chapters in the book, all right? You must read the material in the lab manual. There's no way around that, all right? In addition to doing that, my recommendation is to keep a separate notebook. And in that notebook, you write down the bold terms and define them, the major concepts and define them, and you draw and label anything that you run into. And you might say, well, that sounds like a lot of busy work. Well, it does, but there's a reason for this. The more of your brain you use doing something like this, the more likely going to be successful on an exam, on a lab practical, because you'll be able to recall that material and successfully answer the questions, okay? If you try to cram, it's not going to work, all right? 99 times out of 100, that results in failure, okay? So don't wait. Do a little bit every day, master that material, move on to the next thing. If you get to the night before the exam, or the night before the exam is due, and you realize that you've got to cover 5 chapters, good luck, but I don't think the chances are very good, okay? The other thing I strongly recommend is that if something is puzzling to you, you don't understand something, and you can't find the information in the material, that's when you contact me. I don't get this. I don't understand this. Tell me, all right? Tell me by email or call me on my cell phone, and I'll walk you through it. Office hours are a good time to do that, all right? I can also do that during some lab time as well, okay, if you have questions. But you have to have a study strategy. Now, what a lot of people do is they form study groups. So you get a group of 3 or 4 students, you get a chapter assigned, right, and you can break that chapter into pieces. One person will take one piece of the chapter, another person will take another piece, and then you meet and you share intel and you quiz each other, right? That's the other thing that's a key to being successful in this course is you have to practice, okay? Which means you have to try to answer questions using the knowledge that you've gathered, and you have to be able to do that repeatedly, okay? You have to be able to do it within a reasonable amount of time, and you have to be specific about your answers, okay? An example, right, on a lab practical, if I point to a structure and ask you, what does this structure do, all right? You have to be specific about what it does, right? If I say, had labeled the biceps brachii, all right, which is a muscle in your arm, your upper arm, that crosses the front of the elbow, and when it contracts, it does elbow flexion. An answer like moves the arm isn't going to get it. You have to tell me specifically what it's doing, okay? Don't be vague. And spelling counts, all right? So practice being able to spell the words. Another thing you have to practice is learning of new language, okay? A lot of the terms you're going to run into here are based on the Greek and on the Latin. They got the naming rights because they got to the human body first. And so we have to learn their prefixes, their suffixes, and their word roots. If we had been the first to get to the human body, this would be an easier course because we could use names like upper arm muscle and shoulder muscle, right? And everything would be very, very simple. But we didn't. We have to learn their language and understand their terminology, okay? So those are some other recommendations, right? Resources I've posted and I've talked about, right? And you're free to look at other resources as well. Anything that helps you out, that's good. Okay, let's start about talking about life, right? What is life, all right? Well, it's sort of a gray area in biology because there are some phenomena that kind of look like life but don't satisfy all the criteria. One of the things that we note in all living things is that they're organized, right? They have a certain structure to them, and that structure is a result of particular functions that need to be carried out. All living things do metabolic reactions, which means that they pull energy out of fuel molecules and they use that to produce a type of energy that's used to do work. Okay, and so we can divide the metabolic chemical reactions in a living thing into anabolic reactions, which take small things and make big things from them, and catabolic reactions, which tear big things apart, pull out the energy, and use that to make a form of energy that can be used to do work. All living things grow and develop, meaning they change in size and they change in their characteristics over time. They all respond to their environment, meaning that they're capable of encountering a stimulus, which is any change in the environment, such as a change in temperature, pressure, odor, pain, you name it. All right, there's all sorts of stimuli that go on around us, and we're able to, as a result of detecting those stimuli, respond in a way that makes it more likely for us to survive. Otherwise, we'd be out of luck. Okay, you can see something like this in something as simple as a bacterial cell, right? A bacterial cell knows to run towards an environment that will provide a proper temperature, pH, and some nutrients, and away from a toxic environment. And if it couldn't do that, it would die pretty quickly. Okay? Regulation, right? It can adjust its internal functions to adapt to environmental changes, right? And that's part of responsiveness. And then homeostasis is the ability to maintain certain properties that are critical to maintain life within a range that is compatible with life. Examples would include things like body temperature, body pH, blood oxygen content, blood sugar levels, and so on. Okay? It also has the ability to reproduce, meaning it can make copies of itself, either to regenerate new tissues or to regenerate new organisms. Okay? So when we look at a living thing, we can go from a very simple level of organization to a very complicated one. All right? We can begin at the chemical level with atoms and molecules. We can graduate from there to the cellular level, which are the smallest units of living matter. Then the tissue level, which are groups of cells doing something that a single cell can't. The organ level, which are groups of tissues doing something that a single tissue can't. The organ system level, which would be a group of organs that do something a single organ can't. And then the organism, which is the whole shooting match. That's your body, right? So we could see an example here, okay? Let's start from simple to complex, okay? We do the laser pointer so you can see. There we go. All right. So you start here, right? Atoms can connect to each other to form molecules, which can connect to each other to form big molecules called macromolecules, right? A lot of these are what we call polymers, which are repeating chemical units hooked together in a chain. Then macromolecules can assemble to form organelles, which are structures inside cells that have a particular task to perform. Usually the reason for an organelle is to put all the components critical for chemical reactions that sustain life in one location so that they happen more effectively. So it's kind of like a little factory. And the organelles also isolate chemical reactions that interfere with each other from each other. Okay? And then you have the cellular level. The cell is the smallest unit of living matter. Okay? And then you have the tissue level, which are groups of cells doing something a single cell can't. There are four main tissue types: epithelial, connective, muscle, and nervous. Here you can see an example of epithelial tissue, and another is connective tissue right underneath it. And then you have organs, right, such as the small intestine, okay, which is a collection of different tissues, right? The lining, the inner lining of the small intestine is epithelial tissue. And then on top of that is connective tissue. And on top of that is muscle tissue, which can contract using chemical energy. And then there's nerve tissue in there, and there's a blood supply, right? And then there's connective tissue that latches the small intestine to surrounding structures so it doesn't twist, buckle, or kink, okay? So that's an organ, right? Multiple tissues doing something that one can't. And then here we got an organ system, right? The digestive system does what? Well, it takes our nutrients and it breaks them down their simplest components so that they can be loaded into the blood so that they can be transported first to an organ called the liver, and then the liver can store those nutrients for a time, and then when we need them, it can release them into the blood as things like sugars, okay, that can be taken in by tissues and used to make energy, all right? And then the organism is the whole thing, that's you, right? Well, if any of these organ systems, and we'll go through them, were to shut down, then you would die probably, right? An example would be, let's take the digestive system. Let's say that I was a bad person and I sewed your mouth shut, right? Well, what would happen? Well, you wouldn't be able to eat any food. You wouldn't be able to drink anything, right? With no nutrients and no water coming in, you don't have the ability to put nutrients into the blood. We don't have the ability to make energy in the cells and tissues, and what's going to happen is those cells and tissues are going to shut down. They're going to die, okay? And that'll be the end of you as an organism, right? We could do the same with almost any body system. So they're interdependent. They depend on each other to work. So what are these systems? Well, there they are, right? Integumentary, skeletal, muscular, nervous, endocrine, cardiovascular, lymphatic, respiratory, urinary, digestive, and then male and female reproductive system. So let's go through each one, okay? We'll start with integumentary system, right? That's your hair, your skin, your nails, and your sweat and oil glands, okay? And so what is it for? Well, it's protection, right? There's an outside and an inside to your body, right? And the outside of your body is surrounded by stuff that is trying to make you sick, like viruses and bacteria and mold and parasites, okay? Let alone things like toxins. Well, your skin guards against that, all right? It's sort of a first shield against things that would probably ruin your health, okay? It also is an important source of vitamin D, which is used to mineralize bone. It regulates body temperature, and it serves as a sensory organ and a blood reservoir, right? You can tell, for instance, when things are crawling on your skin or when there's a painful area on your skin. And when you need to mobilize blood and send it to places like your heart, your lungs, or maybe to your digestive and urinary system, say after a meal, you can utilize the blood that supplies the skin and route it to those areas to use, okay? Skeletal system, the bones and cartilage that provide a framework around which our soft tissues hang, okay? It is made up of osseous tissue, bone, and cartilage, all right, which are two types of structural connective tissue, okay? The components include the axial skeleton, which is the skull, the vertebral column, the sacrum, and the coccyx, as well as the rib cage and the sternum, and then the appendicular skeleton, which are the pectoral and the pelvic girdle, and the bones of the arms and hands and the legs and the feet, all right? What does it do for us? Well, not only does it provide our body a framework, it protects a lot of our vital organs. It provides a source of minerals. It makes blood, and it provides for movement structures that are called joints, okay? We have what's called an endoskeleton. Our hard parts are on the inside. So as our skeletal system grows, our soft tissues can stretch and grow to accommodate that. Some organisms have what's called an exoskeleton, where their hard parts are on the outside, and when they grow, they have to shed their skeleton and secrete a new one. An example would be something like an insect or a crab or a lobster, a crustacean, right? The muscular system allows us movement, both internally and externally. It's also a way to maintain our posture and a source of heat, and it also provides some protection for our internal organs, okay? There's three kinds of muscle tissue: skeletal, cardiac, and smooth. The only one that we control with our conscious mind is skeletal muscle. It's connected to bones, and it allows us to move around in our environment and manipulate it, okay? The other two types are cardiac, which is found in the heart and pumps blood, and smooth muscle, which is found in the walls of hollow organs, attached to every hair in your body, around sphincters in the urinary and the digestive system, and in the iris of your eye, okay? And those two muscle types are not under conscious control. They operate at the command of something called the autonomic nervous system, or sometimes they respond to chemicals called hormones. And then we have the nervous system, right? There's the nervous system. There's a central and a peripheral nervous system. The central nervous system is the brain stem, and the spinal cord. And the peripheral nervous system are all of the nerves that come out from there, right? The job of the nervous system is to serve as a communication network. This is how we're able to respond to stimuli and also send commands to different organ systems in order to maintain an environment compatible with life, right? It is a high energy system, okay? The other communication system is the endocrine system. The endocrine system is like a low-tech version of the nervous system, and it communicates through hormones, which are chemicals that are secreted in the blood, carried around the body by the beating action of the heart, and when they attach to tissues that have receptors for those hormones, they carry out activities that create conditions that eventually turn the secretion of those hormones either off or down. The reason we have two communication networks in the body is because it would be too expensive in terms of energy to use the nervous system for everything. The cardiovascular system, the arteries, the veins, the capillaries, the blood, and the heart, right? What's its job? Basically distribution of what? Of fluid, of hormones, of nutrients, of oxygen and CO2, of immune components, all right? The heart does the pumping of the blood. That's what drives it around the body. The arteries carry blood away from the heart. The capillaries are tiny vessels with thin walls, which are there for exchange of nutrients, waste products, and gases. And the veins carry blood back to the heart. Okay? And then the lymphatic system, which is made up of the thymus, the lymph nodes, the lymphatic capillaries, vessels, and trunks, the spleen, and the mucosa-associated lymphatic tissue, and the tonsils, is there to clean fluid that is not recovered by the capillary beds in the circulatory system by removing cancer cells and pathogens, and then returning that filtered fluid to the blood at the subclavian veins. Okay, so it's a way of basically getting rid of bad stuff that has managed to make it through our body's defenses. And then we have the respiratory system, made up of the oral cavity, the pharynx, which is your throat, the larynx, which is your voice box, the trachea, which is your windpipe, and the bronchi, which go into the lungs, and then the diaphragm, which is the muscle of breathing. And the purpose of the respiratory system is to pull in air, which is 20% oxygen, to load that oxygen into the blood by binding it to a molecule called hemoglobin, which is found inside of red blood cells, and to remove the waste gas carbon dioxide. The reason we need the oxygen is because our cells and tissues make 20 times more energy when oxygen is around versus when it isn't, okay? So a biologist would say that we are obligate aerobes, meaning we have to have oxygen in order to survive. Okay. Next organ system is the urinary system, which is made up of the kidneys, the ureters, the urinary bladder, and the urethra. And the job of the urinary system is to clean waste out of the blood, primarily waste that contains nitrogen. Okay? Nitrogen, when it's found in organic molecules, which are molecules that have carbon and hydrogen in them, as well as, in this case, of the waste product nitrogen, are powerful bases, and they change the pH, creating toxic conditions in the blood that could kill cells and tissues. So we have to put that into our pee and pee it out so that we don't die. All right. If you lose kidney function, if both your kidneys shut down, you have about 2 days to live if we don't put you on something called dialysis. All right. That's how important the kidneys are. The digestive system, we kind of already talked about it, right? It takes the nutrients that we eat and breaks them mechanically and chemically down into smaller building blocks that can be loaded into the blood, and from the blood can be carried to our tissues, and they can use that to generate energy, to do work, and they can use the building blocks to build parts that they need in order to survive, such as new proteins. Okay? And finally, the reproductive system, which comes in 2 flavors, male and female. The male reproductive system consists of the scrotum, the testes, the epididymis, the seminiferous tubules, the vas deferens, the prostate gland, the bulbourethral gland, and the seminal vesicle, okay, as well as the external organ, the penis. And its purpose is one purpose, which is to create and distribute the male gamete, which is the sperm cell. And then the female reproductive system creates and distributes eggs, which is the female gamete, but also has to house the new infant for 9 months prior to its arrival into the world as a neonate. So it has ovaries, fallopian tubes, a uterus, a vagina, a cervix, and also mammary glands, right? The purpose of the mammary glands is to produce milk for the infant once it's born. That's why we're called mammals, all right? And the purpose of the ovaries is to create and distribute the eggs. And the purpose of the remaining structures is to house the fertilized egg, which is called a zygote, which then develops into a blastocyst, and then a gastrula, and then an embryo, and then a fetus, and then once it's born, it is a neonate, it is a newborn, all right? So it has a big job. When we talk about the human body, we have to have a baseline of comparison in order for the way that we communicate with each other in a clinical setting to make sense. And that's what anatomical position is all about, right? You're standing upright, you're parallel and flat on the floor, your upper limbs are at the sides of your body, your palms are facing forward, your head is level, and your eyes look forward, right? Slices of the body, which are sections or planes, allow us to visualize internal structures or to locate internal structures relative to each other, okay? So examples include the coronal plane, which cuts you into a front and back half, a transverse plane, which cuts you into a top and bottom half, a mid-sagittal plane, which cuts you into an equal left and right half, and a parasagittal plane, here called a sagittal plane, which cuts you into unequal left and right halves, and then oblique planes, which can pass through the body at an angle of any of those others. So there's an example of some of these different planes of section, right? There's a coronal section, the phallic region, the head. There's a sagittal section through the same area, and there's a transverse section through the same area. And you can see different structures in different views. For instance, in the transverse section, you can see the cerebral cortex, the ventricles of the brain, the optic nerve, and the eyeball, okay, and portions of the nasal cavity. Here in the mid-sagittal, you can see the cerebral cortex, a structure called the corpus callosum. You can see the septum pellucidum. You can see the midbrain, the pons and medulla oblongata, and the spinal cord. Okay, and in the coronal section, you can see cerebral cortex. You can see longitudinal fissure. You can see the eyeballs. You can see the nasal cavity, and you can see portions of the facial bones as well. All right. So the reason this is important is because this is what we do with body imaging, is that we are able to visualize internal structures without having to cut you open and look at them. And that happened as a result of the discovery of things like X-ray and the development of MRI and CT. And that means that we're able to locate damage and determine the extent of it. And that lets us plan our surgical procedures so that they don't take as much time, and it's more likely that the patient will survive the surgery and that the surgery will have a successful outcome. Before we had this capability, we had to cut you open and look around to find the problem. And sometimes we'd find it, and sometimes we wouldn't. And if we didn't find the problem, we'd have to sew you back up and tell you to wait until the problem came up again, and then we'd have to do it again. And oftentimes that had a very poor outcome for the patient. One of the ways that we examine tissues is that we take thin sections of organs and we stain them and fix them and put them on a microscope slide in order to see what they're made of. So when we do that, sometimes we will section in different planes and get different appearances from those sectioned organs. And I just wanted you to see how they can appear, right? These are all different sections through a tubular organ, which could be a blood vessel or a piece of small intestine or a bit of trachea, right? You can get all of these different looks depending on how you section the tissue. When we use directional terms, we are utilizing a common language that's designed to indicate relative locations of things, okay? So what I want to do here is show you a quick video that'll orient you to that. All right, so let's take a look at some anatomical language here. So pull that up. We can do it this way. Here. More. Here. Okay. Got it.
The language of anatomy.
If you're going to be successful in the study of anatomy, you got to be tough. And there are certain terms that are used over and over again that we have to beat into your head so you can succeed.
I'm Slim Goodbody. I'm Slim Goodbody. Good body. Slim Goodbody. I'm Slim Goodbody. Hi, I'm Slim Goodbody, and I'm going to walk you through some of the terms you need to learn in order to understand anatomy. Anatomists have invented a special language that's really going to help us out as we chart our course through human anatomy. This language gives everyone who's familiar with it a universal understanding, and clarity when discussing the body. So we'll need to be really familiar with it. For example, the word anatomy comes from the Greek words tumi, meaning to cut, and ana, meaning up, to cut up.
A lot of people use the term gross anatomy when studying the body. This is a specific type of anatomy. The term gross anatomy, contrary to popular belief, is not the study of footings, underwounds, or the death from family ties, but rather the study of bodily structures visible to the naked eye.
But since we're studying general anatomy, we're dealing with structures both visible and invisible to the naked eye. Because of this, it's important that you learn the terms that describe bodily orientation and direction. You want to be able to describe where certain parts of the body are located, and you also want to be able to understand us when we're describing where a structure is found relative to another one. So a firm grasp on these anatomical terms will help you get a handle on how to locate and identify different bodily structures. So the first term you want to memorize is anatomical position. This is the standard position we refer to when we describe the location of body parts. We do this by separating the body into distinct parts using imaginary planes. These planes are known as the transverse plane, the frontal plane, and the sagittal plane.
The transverse or horizontal plane runs from right to left and divides the body into superior and inferior sections. Superior means above or upper, and inferior means below or lower. So the head is superior to the neck.
The frontal plane lies vertically along the body from head to foot. This is the long axis of the body. The frontal plane cuts the body up into anterior and posterior parts. Anterior means front, and posterior means back. So your rear end is posterior to your belly button.
And finally, the sagittal plane lies vertically, and it divides the body into right and left sections. When dealing with this section, the terms medial and lateral come in handy. Medial means toward midline, or the inner side of, and lateral means away from the midline, or on the outer side of. So, the groin is medial to the thigh, because it's on the inner side of the thigh, and the eye is lateral to the bridge of the nose, because on the outer side of the bridge.
Two other useful terms are proximal, meaning near the trunk, and distal, meaning further from the trunk. The trunk in this case refers to the axis of the body from where most limbs spring. So the elbow is proximal to the wrist because the elbow is closer to the trunk. And the foot is distal to the leg because the foot is further from the trunk than the leg.
So there you have it. We've cut the body into different parts and given you the terms to help you navigate it. Memorize these and you'll be on your way.
So when we're talking about anatomical directions, we always talk in terms of opposing pairs, right? Anterior towards the front of the body, posterior towards the back, superior towards the head, inferior towards the feet, medial towards mid-sagittal midline, lateral away from it, proximal along a limb closer to the trunk, and distal along a limb further from the trunk. And we'll get into a more detailed explanation of these in lab actually this week, right? Regional anatomy deals with the axial and the appendicular regions of the body. Axial region, head, neck, and trunk, which is the long axis of the body, and the appendicular, the arms and the legs, okay? And what you're looking at here is a map of the human body and the different regions. And all I can tell you is you need to know this map, all right? So I won't go through every single term, but I'll give you an example of why knowing this map is important. Let's take the femoral region, which is the thigh, all right? There is a large bone in the thigh called the femur. There is a set of 4 muscles on the front of the thigh that allows you to kick because it crosses the front of the knee and attaches to the leg, and they're called the quadriceps femoris. There is a 2-headed muscle on the back of the thigh that crosses the back of the knee and attaches to the calf and allows you to bend your knee, and that's called the biceps femoris. There's a major artery that runs through the femoral region called the femoral artery, a major vein called the femoral vein, and a major nerve called the femoral nerve, okay? So the utility in understanding this map is that the names of a lot of the structures can give you a location, and that can help you find them and understand what they do. All right, so this is very good flashcard stuff, and I believe there's an exercise in the lab manual where you have to label these guys out so that you know where each of these structures are located. Notice some of the terms are held in common on the back of the body as on the front, and notice it in both of the drawings, standing in anatomical position. Feet flat on the floor, palms facing forward, okay, head facing straight ahead, okay. Now there are also some internal body cavities that we need to become familiar with. There is a dorsal and a ventral cavity, all right. Let's take a look at some of these body cavities.
Body, muscle, organs, and the trajectory for some of those. But it turns out that our bodies actually contain many important spaces, the cavities. Some of these cavities, like for example the nasal cavity, open to the outside of the body. However, most of our cavities are internal. Body cavities have several important functions. Firstly, they protect delicate organs, like for example the brain, from bumps and shock when we walk, run, and jump. Secondly, cavities allow internal organs to change shape and size. For example, our lungs, stomach, and bladder can all expand and contract because they sit inside cavities. And lastly, body cavities provide a warm, nurturing space for foreign creatures to implant into, both and just from in the alien movies. That's it, man. Game over, man. Game over. The human body consists of 2 main cavities, the dorsal body cavity and the ventral body cavity. If you're not sure what the terms dorsal and ventral mean, check out my other video on anatomical terminology. Let's start with the dorsal body cavity. It can be divided into 2 parts, the cranial cavity and the spinal cavity. The cranial cavity is the space formed by the bones of the skull. It contains the brain. The spinal cavity, which is sometimes also called the vertebral canal, is a space formed by the bones of the vertebral column. The spinal cavity contains the spinal cord. Next is the ventral body cavity. It can be subdivided into 2 parts, the superior thoracic cavity and the inferior abdominopelvic cavity, which is separated by a flat muscular sheath called the diaphragm. The thoracic cavity can be subdivided into the left and right pleural cavities and the central pericardial cavity. The pleural cavities contain the lungs, and the pericardial cavity contains the heart. Separating these three cavities is a partition called the mediastinum. The abdominopelvic cavity can be subdivided into a superior abdominal cavity and the inferior pelvic cavity. The abdominal cavity contains the stomach, liver, spleen, kidneys, small intestine, and most of the large intestine. The pelvic cavity contains the bladder and internal reproductive organs. Thanks for watching. Subscribe to my channel and stay tuned for more Human Biology Explained videos.
So, important thing to understand about these different body cavities is that some of them are exposed to the outside world and some of them are not, okay? The body cavities that are exposed to the outside world include the orbital cavity, where your eyes are located. They also include the digestive tract, the respiratory tract, the urinary, and the reproductive tracts. And because of that, all right, we have to line them with something that is protective, all right? And that protective lining is called mucous membrane, all right? Mucous membrane produces something called mucus, which traps particulates and pathogens and flushes them out of those cavities so that they can be more easily eliminated, all right? The cavities that aren't open to the outside world include the cranial cavity, the vertebral canal, okay, and the ventral cavity, which includes the thoracic and abdominal pelvic cavities. And in the thoracic and abdominal pelvic cavities, we have subdivisions. In the thoracic cavity, we have two pleural cavities where the lungs are housed, and a pericardial cavity where the heart is located. That's between the two pleural cavities. And then there's a space called the mediastinum. And then the abdominal pelvic cavity can be divided into the abdominal cavity and the pelvic cavity. The pelvic cavity starts at the pelvic girdle on down through the inguinal region, and the thoracic and the abdominal cavity runs from the diaphragm to the top of the pelvic cavity. Okay? In cavities that aren't open to the outside world, we line them with something called a serous membrane, which is a double-layered membrane. One of the layers clings to the organ, the other layer clings to the cavity, and in between those layers is a lubricating fluid. And what that allows is movement of the organ so it doesn't irritate, inflame, and scar itself. A membrane is simply a tissue layer that's made up of epithelial and connective tissue. And it's the epithelial tissue that secretes the serous fluid, all right? These cavities are not as well prepared for infection, and that's because they shouldn't be open to the outside world. And so that's why a ruptured lung or a ruptured appendix, for example, are very dangerous because they now connect two cavities, one open to the outside world and one that's not, and the risk of infection is very high, okay? The other thing that those serous membranes do is that they secure the location of the internal organs so that they don't twist, buckle, or kink, all right? So you can see the cavities here, right? You can see let's get the laser pointer up again. Yeah. You could see the dorsal cavity, which is made up of the cranial cavity and the vertebral canal, right? And then there's the thoracic and abdominal pelvic cavity, which can be split into the abdominal and the pelvic cavity, right? And then in the front view, you can see how the thoracic cavity can be divided into the pleural cavities. There's the two pleural cavities where the lungs are, and there's the pericardial where the heart is going to sit. And that's the mediastinum, which contains the pericardial cavity. And there's the diaphragm, which is the muscle of breathing that separates the two, right? So if we look here at these protected cavities, right, the membrane that surrounds the central nervous system is actually a series of membranes called meninges, right? The three meninges are from superficial, which is closer to the surface, to deep, which is further towards the organ, the dura mater, the arachnoid mater, and the pia mater. And what they do is they stabilize the position of the central nervous system structures, and they provide a route for a blood supply, and they also provide an area for a fluid called cerebrospinal fluid to circulate and bathe these organs so that they can float in an environment and not damage themselves. And it also provides the proper chemical environment for them to do their work. Then in the ventral cavity, you've got the pleural cavity. The lungs are located, and the visceral and parietal pleura surround this cavity. The visceral pleura clings to the lungs, and the parietal clings to the pleural cavity on each side. And then there's the pericardial with the heart. It has a visceral and parietal pericardium. And then down here, the membrane covering the abdominal pelvic cavity is called the peritoneum, okay? And there's a visceral peritoneum that covers portions of the digestive system. And there is a parietal peritoneum that covers the chamber of the abdominal pelvic cavity, okay? So parietal covering the chamber, visceral covering the organs, all right? And again, providing lubrication, stabilization, protection, and a route for nerve and blood vessels, okay? You can see how the cavities are set up here, right? Serous membranes have an outer and an inner layer with the organ clinging to the inner layer, and then the fluid would be in between the visceral and the parietal layers. A mechanic will tell you that any moving part needs lubrication or it'll become damaged. The same is true for your moving internal organs. And all your internal organs are always moving. I know it's kind of weird to think about, but they are, okay? And if you don't have a lube job, they're going to get damaged. You can see the different cavities here, right? We've talked about where they are. There are the rest of them, right? The pleural, parietal and visceral, and the pleural cavity, okay? And there's their location, right? There's the pericardial cavity, the parietal pericardium clinging to the chamber, and the visceral pericardium clinging to the heart itself, and the pericardial fluid between the two, right? And then there's the parietal and the visceral pleura, okay? Inflammations of these membranes always end in the term itis, itis, right? So pleuritis or pleurisy is an inflammation of the membranes lining the lungs, and it results in pain when breathing. And pericarditis is an inflammation of the pericardial membranes, and it results in a radiating pain through the chest. Okay? The abdominal cavity contains most of the digestive organs, the kidneys, most of the ureters, while the pelvic cavity is the distal large intestine, the rest of the ureters, the bladder, and the internal reproductive organs. Okay? The parietal peritoneum, we already indicated, lines the cavity of the abdominal pelvic region. The visceral clings the abdominal and pelvic organs. Okay? And the peritoneal cavity is simply the space in between them. And you can see here how they're arranged, right? You can see that these membranes are going to encircle large sections of the digestive system. This is a mid-sagittal view, so you can see things like the small and large intestine, the liver, the stomach, okay, and the rectum and anus, and the descending and sigmoid colon, all right? And you can see how they're held in place by these membranes, but also the membranes provide lubrication and stabilization, as well as a way for the nerves and the blood vessels to get back and forth from the organs. Okay? We can also divide the abdominal pelvic cavity into quadrants and regions. Okay? These are the regions of the abdominal pelvic cavity. Right and left hypochondriac, right and left lumbar, and right and left iliac, and then down the center, epigastric, umbilical, and hypogastric. Now, you might write those down and memorize those, and that would be great. But if we take a minute and think, all right, we can get meaning out of these names, and it'll make more sense when you run into these terms later on, okay? So let's go down the middle first. Epigastric, all right? The prefix epi means above or upon. Gastric means stomach. So this is the area above the stomach. Where's stomach? Right there, okay? The umbilical region gets its name because that's where your navel is located, and that used to be the attachment for the umbilical cord, which was the lifeline that ran between you when you were a fetus and your mother's placenta, okay, which was the organ that filtered the good stuff out of her blood and put it into your blood, and filtered the bad stuff out of your blood and put it into her blood, okay, the lifeline. The hypogastric region gets its name because it's under the stomach, okay? Hypochondriac, well, hypo means under. Chondriac means what? It means cartilage. So where are we? We're under the cartilage that connects the ribs to the sternum, right? Lumbar refers to the lower back. The lumbar vertebrae are the largest and thickest vertebrae in the vertebral column and support the most weight. And the right and left iliac regions refer to the ilium of the pelvic girdle, which is the big fan-shaped part of your pelvis, where if you put your thumbs in your belt, right, you feel your little hip pointers, that's the crest, the ilium right there, okay? Now you might recall the term hypochondriac is coming to mean something different, right? You probably heard the term hypochondriac used to refer to people who think they're sick all the time when they're not. Well, why is that? The reasoning comes from the ancient Greeks, right? The ancient Greeks believed that the liver and the gallbladder and the spleen were the key to health, right? Well, guess where those lie? In the hypochondriac region. Now, were the Greeks right about that? No, okay? The key to health is all the organ systems working properly. But the colloquial term then came to mean a reference to your health, right? A hypochondriac thinks that they're sick when they're not, and that comes from the ancient Greek thinking all of your health is related to the organs in these regions, okay? A lot of the terms that we today have their roots in much, much older and arcane language. An example would be carrying somebody across the threshold, right? You probably heard the term threshold and used it, never thought about it, right? But what does threshold literally mean? Well, before we had hardwood floors and tile, we used to live in the huts that had dirt on the floor, and in order to not have mud inside the hut, we would put down straw or thresh. And in order to keep the straw or thresh inside the hut, we would have a bar across the bottom of the door, which was called a threshold. All right, and that kept the straw in there and cut down on the mud production. All right, so when you're carrying somebody across the threshold, that's what you're actually talking about. Okay, a lot of our old sayings have roots in things like the Middle Ages, practices in the Middle Ages, and it's kind of interesting to find where those sayings come from. Okay, so there are the different regions. There's their locations, and we can note the organs that are in those regions. And knowing that, then we can determine what a person's problem might be if they come in with a chief complaint in a particular region of the body. For instance, if somebody comes in and you poke them in the right iliac region and they scream, okay, then they might have a problem with their appendix, which hangs off of the bottom of this little sac called the cecum. And occasionally the appendix gets plugged with fecal material, and the bacteria in there produce gas, and that produces pain and distension. It causes the organ to swell up, and it hurts. Okay, and the result of that then is you got to take it out or it'll rupture. Okay, so we can use this as a diagnostic. All right, it's a way to tell us what might be wrong with somebody by knowing what organs lie under those areas. We can do the same with quadrants, right? Right upper, right lower, and left lower quadrant, and noting the organs that each contain, right? There's your liver, your gallbladder, your stomach, your spleen is back here. This, of course, is your diaphragm, right? This is your transverse colon, your descending, and your sigmoid colon. There's your bladder. There's your cecum, your ascending colon. There's your small intestine, okay? And then, of course, your kidneys are stuffed behind your liver and your stomach and your spleen at the level of the floating ribs, right, which are your 11th and 12th ribs. So knowing where those organs are, knowing that anatomy will help you out quite a bit, okay? The next big topic we want to discuss is homeostasis, which is the ability of the body to maintain critical values necessary for you to live within a range compatible with life. So let's take a listen to homeostasis. Let's go back to the pointer.
Fluctuations in the internal and external environments are constant for living organisms. The body responds to these fluctuations by a process called homeostasis, the process of maintaining a relatively stable internal environment. We will look at fluctuations in blood glucose levels as an example of homeostasis. You are studying for a biology exam, about to review the chapter on cellular respiration, and decide you need a little extra energy. You consume an entire 32-ounce bottle of soda, approximately 1 liter. Your mid-study snack contained 100 grams of sugar and 400 calories. At first, you might have a burst of energy, but 30 minutes later, you begin to feel lightheaded and can't seem to keep your eyes open or your mind from wandering. What happened? To understand this unexpected result, we'll explore how your metabolism can get out of balance and how your body works to bring it back to normal. The cells of your body are fueled by glucose molecules that travel throughout your body in the bloodstream. Because glucose is so important, your body responds to fluctuations in blood glucose levels to maintain stable levels through homeostasis. After consuming food, the mouth and stomach begin the process of mechanical and chemical digestion. The partially digested food moves from the stomach to the small intestine, where larger molecules are further broken down. Smaller molecules, like the monosaccharides, glucose and fructose, are absorbed by the cells lining the intestine. Glucose passes out of the cells and into the interstitial fluid, then into the bloodstream. Once individual glucose molecules move into your bloodstream, your blood glucose level rises rapidly. The high sugar content of the soda causes a spike in blood glucose, triggering a hyperglycemic condition. The pancreas detects an increase in glucose levels in the bloodstream. In response, the beta cells of the pancreatic islets produce and secrete the hormone insulin into the bloodstream. Insulin binds to cell surface receptors and stimulates the transport of glucose into the cells of the body. Because of this rapid increase of insulin in response to the large amount of glucose from the soda, too much glucose is removed from the blood and stored as glycogen inside liver and muscle cells. As a result, your blood is now glucose deficient, a hypoglycemic condition. This low blood glucose level can cause lightheadedness, fatigue, and hunger. In response to glucose-deficient blood, the alpha cells of the pancreatic islets will produce and secrete the hormone glucagon. Once glucagon levels rise in the bloodstream, glucagon will diffuse out of the blood and bind to cell surface receptors in the liver, triggering the conversion of glycogen to glucose in liver cells. The stored glucose is released back into the bloodstream until homeostasis has been achieved. Turn back the clock. What would happen if you ate an apple, a handful of pistachios, or some popcorn instead of a liter of soda? The consumption of complex carbohydrates instead of simple sugars, like the ones found in the soda, results in a lower spike in blood glucose. Complex carbohydrates, like those found in healthier snacks, take longer to digest, so glucose is slower to enter the bloodstream. Homeostasis of blood glucose levels is more easily maintained because the drastic changes to glucose concentrations are diminished, without feelings of hunger or fatigue. The hunger experienced during bouts of low blood sugar, in addition to disrupting short-term homeostasis, can be a contributing factor to overeating and long-term problems like obesity. Glucose is also taken up by adipose cells during the spike in blood glucose and can be converted into fat. This, along with exaggerated portion size, sedentary lifestyles, and poor nutritional choices, are contributors to the worldwide obesity epidemic. By consuming more calories from natural sources containing complex carbohydrates, your body can maintain homeostasis of blood glucose levels more effectively. This can reduce your risk of gaining weight and improve your overall health. It can even help you keep focused while studying for that important biology exam.
Okay.
Fluctuations in...
We're at time now, so I'm going to put the rest of this onto a podcast. I'm going to load that into chapter 1, and then you guys are responsible for finishing that and the chemistry chapter before we meet next Monday. Okay? So with that,